Good afternoon, Hartley Winter Surgery, how can I help you? You would like a prescription? And you've got the gold card?
The gold card is something that you wouldn't want to have, but if it gives you the passport to better and quicker care and better communications, it's actually vital to help us improve.
Yes, I think this card will be a very good thing for me to have.
Telling a patient that their illness can't be cured is one of the hardest things you ever do as a doctor. I think we dread it. I think the patients often aren't expecting it and are quite shocked, and I think if you do it well, it's not an easy thing to do, but it often is done very badly, and I think we can improve how we do it. The end of life pathway has been something we've worked on to try and improve, and this is looking at particularly someone's last year of life, but to improve the quality of their care, primarily communication. I've got a leaflet, or a booklet really, with lots of information, because I know what we've just talked about is a huge shock, and you may well have other things that you want to ask or that crop up, and nothing quite beats actually sitting down and talking face to face to a patient. So you can choose which bits are helpful for you, but at least if you've got a place that you can go to, I think that would help. And if you've got any questions, please come back to us and we can go into it further.
Integrated care teams are in fact GPs, district nurses, social services who are going to work closely together and make sure all those gaps that used to happen in the past are now closed.
We need to make sure that the patient knows about the integrated care team and how it works early on and soon after they are diagnosed. So what we've tried to work on to try and build up is an integrated care team between all the people involved in somebody's healthcare. Henry, I'd like to give you a gold card, which I think will improve your care and the people providing your care, the doctors and the nurses. The gold care card will be useful for both professionals to be aware of a patient having it, but also patients being aware they have it, and their carers and relatives, because it means that we are trying to improve care and the ease of accessibility for care, and if patients know that that's what a gold care card entitles them to, they are then able to actually tell a healthcare professional that's what they have. So the gold card on the back will have the number of a key worker, either a nurse or a social worker, someone we identify for you specifically, who you can phone at any time during the day if you have any problems at all. And then it also has the out-of-hours doctor service telephone number that you can ring to get some help.
That's nice.
And there may well be additional numbers on there that are specific numbers that you need that we can fill in when you need them.
I think the gold card scheme is excellent. Most of us have experience of their relatives having gone through the last year of their life, and often we think things could be done better.
It makes it easier, really, to get hold of people when I got the numbers and that, and then they know exactly what the problem is with me, and I suppose it just makes things easier for them as well as it did for myself. So I'm very grateful to that.
I think all patients are very important to all members of the health team, and nobody's care should be jeopardised or thought inferior. But there are particular patients who have illnesses that are very advanced and very difficult to manage.
I think in the past that we have had situations where patients are slipped between different services. I think that the integration of the gold card system will in fact help to close those gaps and ensure that they get the best care.
And I think we as health professionals need those patients highlighted, but I don't think it should take away care from any other patient, whether they have what they think is a small or a large problem. All of their problems are equally important.